Welcome to today's video about crucial symptoms of colon cancer you must watch for.
Colon or colorectal cancer, ranking as the third most common type of cancer for both genders, affects adults age 50 and older, regardless of gender and race. However, over the past 15 years, the number of people aged 20 to 49 with colon cancer has increased by about 1.5% each year. Colon cancer starts when certain polyps or growths develop in the lining of the colon, or the end part of the large intestine, the rectum. When not removed earlier, the precancerous polyps can grow over time, then become cancerous, and spread to the other parts of the body. The good news is colon cancer is treatable and curable, especially if diagnosed early. Nearly everyone survives bowel cancer if diagnosed at the earliest stage. In today's video, we're diving into identifying 9 crucial symptoms of colon or colorectal cancer that you can't ignore. Make sure you stick around until the end to grasp every essential tip on thwarting this highly destructive illness, recognizing its signs, and enhancing your understanding of the condition to safeguard both yourself and those dear to you. Before we delve into the symptoms of colon cancer, let's familiarize ourselves with colon polyps. So, what are colon polyps? Well, they're small growths that develop in the lining of the colon, large intestine, or rectum. They're a type of benign tumor, a cluster or mass of abnormal cells. The main cause of colon polyps is genetic mutations, which are errors in the genetic code that your cells use to reproduce themselves. The cells in your colon lining replace themselves often, so there are more chances for errors to occur. When their code changes, they grow and behave differently. Some gene mutations are passed down for families or hereditary syndromes. Others appear to be random due to multiple contributing causes, including age, diet, such as high red meat intake and low fiber consumption, lifestyle choices, like alcohol, smoking, and lack of exercise, inflammatory bowel diseases, obesity, and a previous history of polyps. The most effective way to detect colon polyps is through a colonoscopy. This procedure allows us not only to visualize the polyp, but also to remove it and send it for lab analysis to determine if it's benign or malignant. While polyps are harmless and not cancerous, almost all colorectal cancer starts from a polyp. So what factors accelerate the transformation of a polyp into cancer? As mentioned above, it's a combination of our genetic makeup and our lifestyle habits that contribute to the development of colon polyps and bowel cancer. There's no way to prevent the genetic mutations that result in colon polyps, but you are able to reduce your risk by taking good care of your general health. Current research suggests that our dietary choices, from the selection of food at the supermarket to its preparation, play a critical role in our health. A balanced diet along with other healthy lifestyle habits can influence gene expression. Specifically, genes associated with chronic inflammation, dementia, obesity, heart attacks, and cancer can become less active when we make healthier choices. On the other hand, poor dietary choices and unhealthy habits can accelerate the activity of these same genes. In simple terms, this could speed up the growth of a polyp and its eventual transformation into a tumor over time. Several factors contribute to this, such as ultra-processed foods, excessive red and processed meat, excessive vegetable oils, sugars, and excessive sodium. These products, or the combination of them, are like adding fuel to the fire for tumor growth. Other contributing factors include constipation, poor or inadequate intestinal flora microbiota, and chronic inflammation. Furthermore, habits like alcohol consumption and smoking are also known to be carcinogenic. Before we continue, if you have been enjoying the video so far, give us a thumbs up and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Now let's delve into the 9 critical symptoms of colon cancer. Number 1. Blood in the stool. You may notice obvious blood in the stool or darker colored bowel movements, which may indicate that there is bleeding within the intestinal tract or rectum. While blood in your stool can be caused by other conditions like hemorrhoids or anal fissures or gastrointestinal bleeding, it's important to consult with a doctor to rule out any serious underlying causes. Hemorrhoids, swollen blood vessels in the rectum or anus, are a common cause of rectal bleeding. Similarly, anal fissures, small tears in the lining of the anus, can also result in blood in the stool. These conditions, while concerning, are generally not associated with colon cancer. On the other hand, gastrointestinal bleeding can originate from different parts of the digestive system, including the stomach, small intestine, and colon. This bleeding may be due to ulcers, inflammatory bowel disease, IBD, or even colorectal cancer. The type of blood in your stool can provide valuable clues. Bright red blood in the stool often suggests bleeding near the rectum or anus, such as from hemorrhoids or anal fissures. In contrast, dark tarry or black stool may indicate bleeding further up in the digestive tract, possibly from the colon or stomach. It's important to note that blood in the stool can sometimes appear as streaks or be mixed in with the stool, making it less conspicuous. Number 2. Rectal bleeding. Rectal bleeding specifically refers to the presence of bright red blood that comes from the rectum or anus. It may be noticeable on toilet paper, after wiping, or in the toilet bowl. This typically indicates that there is bleeding in the rectum or colon, which may be a sign of colon or rectal cancer. Rectal bleeding can also be caused by hemorrhoids. Typically, patients with hemorrhoids experience symptoms that come and go with flare-ups, whereas rectal bleeding caused by cancer usually continues or worsens, and is more likely to be accompanied by pain. Number 3. Changes in bowel habits. If you're experiencing persistent changes in your bowel movements, this could be an early warning sign of colon cancer. Changes in bowel habits that can indicate colon or rectal cancer include new onset constipation or diarrhea, changes in frequency or size of bowel movements, a bowel that doesn't seem to empty completely, a stool that is narrower than normal, even as thin as a pencil. Occasional bowel changes can be caused by a dietary change, disagreeable food, or a viral or bacterial infection. However, if you experience an unexplained change in your bowel habits that lasts more than a couple of days, see your doctor to determine the underlying cause. Number 4. Abdominal pain and bloating. When cancerous tumors grow in the colon, they can obstruct the intestines and cause a buildup of gas and waste. This can lead to stomach bloating, distension, cramps, or pain in the abdominal or bowel region. Abdominal pain is a common symptom of many different conditions, including diet-related gastrointestinal distress, Crohn's disease, or ulcerative colitis, but it can also be an early warning sign of colon or rectal cancer. Abdominal pain associated with colon cancer may be accompanied by other symptoms such as changes in bowel habits, unexplained weight loss, blood in the stool. These combinations of symptoms can be particularly concerning and should prompt immediate medical attention. Number 5. Nausea and vomiting. Nausea and vomiting can occur if a colon or rectal tumor is obstructing the bowel and inhibiting the passage of liquid or solid waste or gas. Bowel blockage can also be accompanied by painful abdominal cramps, bloating, and constipation. Nausea and vomiting are symptoms of a range of conditions, which may be benign or serious. If you experience persistent nausea and vomiting along with other signs and symptoms, it's important to see a doctor to potentially rule out colon cancer. Number 6. Anemia. Anemia is a blood disorder characterized by a deficiency of red blood cells or hemoglobin. These cells are responsible for carrying oxygen to the body's tissues. In patients with colon or rectal cancer, intestinal bleeding can occur without any noticeable bleeding from the rectum or stool. This may lead to anemia. Common symptoms of anemia include paler skin, increased heart rate, fatigue, dizziness, shortness of breath, lightheadache. While anemia can result from various causes, including nutritional deficiencies, chronic diseases, and bleeding disorders, if you experience the symptoms of anemia, especially accompanied by other symptoms of colon cancer, consult with a doctor for further testing. Number 7. Fatigue. Fatigue associated with colon cancer is often more than just feeling tired. It can be extreme exhaustion that interferes with your daily activities and quality of life. This fatigue may be accompanied by weakness and a lack of energy. The connection between colon cancer and fatigue lies in the potential development of anemia, a condition characterized by a reduced number of red blood cells, or a low concentration of hemoglobin in the blood. Anemia can result from colon cancer when the tumor causes bleeding in the gastrointestinal tract, leading to iron deficiency and a decrease in red blood cells. The result is a decreased ability of the blood to carry oxygen, which can lead to fatigue. Number 8. Unexplained weight loss. Unexplained weight loss is a possible sign of colon or rectal cancer, along with many other unrelated conditions. In patients with colon or rectal cancer, these symptoms are usually related. Cancer cells can release substances that alter how your body processes food, leading to a loss of appetite and nutritional deficiencies. Additionally, the body's immune response to the cancer can increase metabolism, causing a person to burn more calories than usual. Speak to your doctor if you experience weight loss that does not have an obvious cause. Number 9. Pelvic pain. Pain in the pelvic area is not common in patients with colon or rectal cancer. If it occurs, it may indicate that the cancer has spread to the pelvic area. This is a serious complication that requires immediate medical attention. Therefore, it's especially important to be aware of the symptoms if you've had intestinal issues in the past. How to prevent colon cancer. Preventing colon cancer involves a combination of lifestyle changes, regular screenings, and sometimes medication to reduce the risk of developing colon cancer. It is advisable to maintain a diet that is high in fiber and rich in anti-inflammatory and antioxidants. This includes fruits, vegetables, and whole grains. Limit red meat, processed meats, and other ultra-processed foods, as they have been linked to an increased risk of colon cancer. Healthy fats such as omega-3s found in fish, eggs, and plant sources like chia seeds, flaxseed, walnuts, avocados, and olive oil are also recommended. Consider adding turmeric to your diet, because it also offers excellent anti-inflammatory and antioxidant benefits. Some recent studies found that it might work against lung, breast, prostate, and colon cancers and help slow the disease's progression. In addition, drinking plenty of water and adding probiotics to your diet may help lower the risk of colon cancer by keeping your digestive system healthy and preventing constipation. Also, avoid excessive alcohol consumption, quit smoking, and engage in regular physical activity. Aim for at least 150 minutes of moderate intensity exercise, such as brisk walking, or 75 minutes of vigorous intensity exercise, such as running, per week. Some medications, such as aspirin and nonsteroidal anti-inflammatory drugs, NSAIDs, may reduce the risk of colon cancer, particularly in people with a high risk due to family history or other factors. However, these medications can have side effects, so talk to your doctor before starting them. Regular screening, such as colonoscopies, is important to detect precancerous polyps or early-stage colon cancer, when treatment is most effective. So what is colonoscopy? A colonoscopy is a medical procedure used to examine the inside of the colon, large intestine, and rectum. It's typically performed by a gastroenterologist, a doctor who specializes in digestive health. During a colonoscopy, a flexible tube called a colonoscope is inserted through the rectum into the colon. This tube has a camera attached to it, allowing the doctor to visualize the lining of the colon on a monitor. During the procedure, if any abnormal tissue or growths, polyps, are found, the doctor may remove them or take a tissue sample, biopsy, for further analysis to determine if it's benign or malignant. Before undergoing a colonoscopy, patients typically need to follow specific dietary restrictions and may need to take medications to cleanse the colon to ensure that the colon is clear, and the doctor can get a clear view during the procedure. The procedure is usually performed under sedation or anesthesia to minimize discomfort. The frequency of colonoscopies depends on various factors such as your age, medical history, family history of colon cancer or polyps, and any previous findings from colonoscopies. For individuals at average risk for colon cancer, colonoscopies are generally recommended every 10 years starting at age 50, as per guidelines from organizations such as the American Cancer Society. However, if you have a family history of colon cancer or polyps, or if you have other risk factors, your doctor may recommend more frequent screenings. Overall, colonoscopies are crucial for early detection and prevention of colorectal cancer, and potentially saving lives through early intervention and treatment. There you have it, 9 crucial signs and symptoms of colon cancer. If you experience any of these symptoms, please make an appointment with your doctor to get checked out. It's essential to stay informed, maintain a healthy lifestyle, and attend regular screenings as recommended by your healthcare provider. Remember that an early diagnosis can lead to more successful treatment options. Before you leave, you may also find some other helpful videos popping up on your screen right now. Feel free to click on any of them, or even better, watch all to continue your knowledge journey with us. Thank you so much for watching. See you in the next video.